versus 8 radiculopathy or 5 versus 6. Proximal median neuropathy is pretty uncommon, but they're there. And it's a nice, very easy muscle. And so the way I localize it is I take my middle finger on the medial of the condyle, thumb on the biceps tendon, which you can feel in most people, actually. Kind of bisect that line with my index finger, and then go 2 finger breadths down. And it should be right at that point. Okay, now roll your hand inward towards it. Yep, you can feel it pop out. Do it again. Right there. That's it. Should be it right there. Now relax. Now one mild challenge with the pronator is that in that region, there can be a lot of superficial veins that kind of run right along there. So I try to avoid those because bleeding risk and discomfort. Blood vessels are actually uncomfortable if you poke them. The other things you want to be aware of in terms of discomfort, bone. So there's a few muscles that are fairly small and opposed very close to bone. If you kind of tap that bone a little bit, the periosteum is super sensitive. And then the fascia is really sensitive. So for some muscles, as you're going through that initial stage of fascia, the epimysium, that can be a little bit of a poke, but that should go away. And then back now. Change the muscle. Now relax as much as possible. So one way, sometimes some people now roll your hand inward. Some people are kind of all or none with the activation, right? You can't get good isolated units. That's not like that. But one way to get away from that is to have people kind of relax, and then just give a little counter pressure. So if I now relax again, there's a little bit of a natural tendency. Relax your hand all the way out. There you go. To kind of give resistance if someone's pushing on you.